Medicaid recipients living in New Jersey, and gentlemen, this is a response to FKASG9SSM OU812 and his Healthcare Reform Americans in London video presentation. I find it funny that most of this video was spent not talking about healthcare, and instead about some anonymous person named Kooky, who allegedly mentioned France when you and this anonymous user were talking about healthcare. Since you did mention France, we will oblige. Did you know France's government-run health scare system has been in the red since 1989? How many private businesses stay going if they've been in the red for 20 years, unless they get a bailout? None. Has been in the red since 1989. This year, the annual shortfall is expected to reach 9.4 billion francs and 15 billion francs in 2010. That's great. Or roughly 10% of its budget. In recent months, France imposed American-style evil co-pays on patients to try to throttle back prescription drug costs. The vast majority of French residents have to purchase some kind of private insurance to cover what the government can't, and they're still in the red. Interesting. Excuse me. Then FKA mentions an alleged trip to the UK taken by some alleged friends of his. The problem with this is that it's hearsay. This reminds me of Dick Gephardt during the 2004 presidential campaign. He was saying, I have a friend who made $1 billion in the last 10 years, and he wants his taxes raised through the roof. He wants to bend over and grab the ankles for the government. That's, you sound like Dick Gephardt. But rather than pull stories out of my butt, let's look at some actual non-popularized literature debunking your claim about health scare in the UK. When I say non-popularized, this means you won't find it laying next to the fish tank in a Tom's River free clinic. A study published in Lancet Oncology found that the 5-year survival rate for all types of cancer among both men and women is higher in America than in any European country. Further, U.S. survival rates are higher than the European average for 13 of 16 specific cancer types. In a separate National Bureau of Economic Research study, June and Dave O'Neill found that Canadian survival rates also lag behind the U.S. rates. American women have a 63% chance of living at least 5 years after a cancer diagnosis, compared to 56% for European women. American men have a 5-year survival rate of 66%, compared to only 47% for European men, so that's a big gap there. Among European countries, only Sweden has an overall survival rate of more than 60%. For women, only 3 European countries, Sweden, Belgium, and Switzerland, have an overall survival rate of more than 60%. For leukemia, the American survival rate is almost 50%. The European rate is just 35%. For prostate cancer, the American survival rate is 81.2%. And again, I'll have all the references on the right side. We don't go by references, we go by real life. We actually provide references. For prostate cancer, the American survival rate is 81.2%. In France, it is 61.7%. And in England, it is down to just 44.3%. Sounds good, doesn't it? Remember, this is the system you think you're in love with. You also remember during the campaign Hussein Obama blathering about computerizing all medical records to save money. This won't save money, but the UK did try it. How do you think that went? In 2002, Tony Blair ordered Britain's National Health Service to participate in the National Program for IT, and thus launched an ambitious attempt to computerize the entire service. The initial projected cost, £2.3 billion. It was widely described as the largest IT project in the history of the world. Fast forward to late 2008, costs have risen to a minimum of £12.7 billion. And since the system was 4 years late in counting, its final cost, actual full in-service date, and even whether it would ever work at all remained up in the air. The Financial Times described it as exhibiting an unhealthy level of Great Leap Forward syndrome. So what went wrong? Where to start? There was the crass malignancy of the government's attitude to its suppliers. The official responsible for delivering the system compared the project to a sled team and failing suppliers to dogs who would be shot and fed to the survivors to motivate them. A year later, he abruptly quit the project after one key firm was accused of accounting irregularities, and another major contractor dropped out and threatened to sue the government to escape from the affair. Now let's move on to some of government-run facets of our health scare system. And what were the projected costs there? I'm sure this is all review to you. Medicare hospital insurance. In 1965, as Congress considered legislation to establish a national Medicare program, the House Ways and Means Committee estimated that the hospital insurance portion of the program, Part A, would cost about $9 billion annually by 1990. Versus actual Part A spending in 1990 that was $67 billion. The actuary who provided the original cost estimates acknowledged in 1994 that even after conservatively discounting for the unexpectedly high inflation rates of the early 70s and other factors, the actual Part A experience was 165% higher than the estimate. For the entire Medicare program, in 1967, the House Ways and Means Committee predicted that the new Medicare program, launched the previous year, would cost about $12 billion in 1990. Actual Medicare spending in 1990 was $110 billion, off by nearly a factor of 10. Not a good track record, I might say with confidence. Whatever Hussein Obama and his lackeys say a public option will cost, you can rest assured it will cost a lot more. In addition, you might want to listen to some statements made by Dr. Carol Sikora, a professor of oncology in London at facesofgovernmenthealthcare.com. He doesn't paint a pretty picture of the UK's government-run health scare system, and it's a lot more reliable than imaginary trips, made by imaginary friends to the UK. Lastly, you mentioned some guy named John Kukl, or Kooky, from Sheldon, Iowa. And you say, Kooky, I also happened to stumble upon a very amusing comment you made to a young woman here on YouTube, which finally shed some light on the wacky mystery that is Kooky. See, I thought you were a middle-aged guy, but you posted a comment on this woman's page stating that you think she is super cute. Now that's funny. I'm not saying you're referring to me. Again, I am not saying you're referring to me, but your statement seems rather odd because just 2 weeks ago, a little over 2 weeks ago, I posted the following comment on user Sarah Smiles 05's channel. I'll have the link up there. I said this to Sarah Smiles 05. I hope you don't mind me saying, but you are super cute. In addition, if you like engaging with rabid liberals, post a comment on my channel. They should come running to vomit on your channel within a day or so. Again, I'm not stating with 100% confidence that you're referring to me. Perhaps in your video response you can clarify that for us. Either that or just drop your little charade of ambiguity. And when you do a video about healthcare, actually talk about healthcare half the time. Because when you do a video and it ends up more than half of it's not even about the topic you originally started on, and you start referring to all, anonymous people and other people named Kooky and whatever, that shows me you're uncomfortable. But we eagerly wait your response to those facts. And again, as we said, the links will be on the right side. You can check them out. We don't pull trips by imaginary friends out of our butt as evidence, and that would be hearsay. So good luck. You will need it.